1. In developing a training program for EDAIC candidates, which adult learning principle best supports self-directed learning and critical thinking in anesthesiology residents? A. Rote memorization of procedural guidelines. B. Providing structured case-based scenarios for independent analysis. C. Mandatory group lectures without interaction. D. Delivering pre-recorded videos without follow-up. 2. When evaluating a candidate's competency in ICU airway management, which method offers the highest validity in aligning assessment with real-world practice? A. Multiple choice written test. B. Peer-reviewed simulation with standardized patients. C. Self-reported experience log. D. Oral presentation on airway anatomy. 3. A curriculum for EDAIC preparation integrates spiral learning. This approach means A. Presenting all content once without revisiting it. B. Revisiting topics at increasing levels of complexity over time. C. Using only basic concepts and avoiding advanced skills. D. Focusing only on theoretical knowledge without practical application. 4. During a mentorship session for anesthesiology trainees, which feedback style is most consistent with effective adult learning principles? A. Giving delayed written evaluations weeks later. B. Providing immediate, specific, and constructive feedback after procedures. C. Only discussing errors at the end of the training year. D. Allowing peers to provide all performance feedback. 5. Which regulatory compliance consideration is most relevant when developing an EDAIC exam simulation in a European hospital setting? A. Conforming to the General Data Protection Regulation (GDPR) for candidate performance data. B. Avoiding international anesthesiology standards. C. Ignoring patient confidentiality rules during simulations. D. Using outdated guidelines to maintain tradition. 6. An EDAIC instructor wishes to measure knowledge retention after a pharmacology module. The best evaluation tool would be A verbal quiz immediately after the lecture. B. A written test administered 1 month later. C. A peer discussion with no formal assessment. D. Asking students to email their thoughts about the lecture. 7. In structuring the ICU portion of the curriculum, the principle of constructive alignment ensures that A. Learning outcomes, teaching methods, and assessment are congruent. E. All teaching focuses on standardized textbook chapters. C. Assessment determines the learning objectives. D. Curriculum design is driven solely by accreditation requirements. 8th, a senior anesthesiologist mentoring a junior EDAIC candidate uses role modeling by A. Demonstrating procedures while verbalizing decision-making steps. E. Giving the trainee a manual and asking them to learn independently. C. Only assessing the trainee's work without offering guidance. Avoiding personal involvement to ensure independence. 9. In a high-stakes simulation for EDAIC preparation, which communication technique most effectively promotes team situational awareness? A. SBAR, Situation, Background, Assessment, Recommendation. B. Indirect hints and nonverbal cues. C. Allowing only the most senior doctor to speak. D. Using complex medical jargon without clarification. 10. When assessing critical incident management skills, a structured oral examination is superior to an unstructured discussion because it A. Requires less examiner preparation. B. Minimizes variability between examiners. C. Focuses exclusively on memorization. D. Encourages spontaneous storytelling. 11. Which principle of adult learning is violated if an EDAIC trainer ignores a candidate's existing experience in regional anesthesia? A. Respect for learners' self-concept. E. Emphasis on experiential learning. C. Alignment of objectives and assessments. D. Feedback immediacy. 12. A formative assessment in the EDAIC prep course is intended primarily to A. Assign a final pass-fail grade. Provide ongoing feedback to improve performance before the final exam. C. Replace summative evaluations entirely. D. Certify completion of training. 13. Which evaluation method best measures psychomotor skills and ICU intubation during EDAIC preparation? A. OSCE, Objective Structured Clinical Examination. B. Multiple choice exam. C. Reflective essay. D. Peer-to-peer discussion. 14. In developing an EDAIC-aligned curriculum, Bloom's taxonomy is applied by A. Structuring learning objectives from lower-order to higher-order thinking skills. B. Grouping all tasks into a single cognitive level. C. Focusing solely on factual recall. D. Avoiding psychomotor and affective domains. 15. A mentor notices that an EDIAC candidate struggles with applying knowledge in complex cases. The most effective intervention is to A. Assign additional theory reading only. B. Use problem-based learning sessions with real clinical cases. C. Reduce clinical exposure until theory improves. Give generic encouragement without specific advice. 16. Which element of curriculum development ensures that EDAIC candidates acquire skills relevant to their practice environment? A. Needs assessment involving stakeholders. B. Using only international guidelines without adaptation. C. Eliminating practice-based teaching. D. Avoiding feedback from past candidates. 17. During a team debrief after a simulation, what type of question best promotes reflective learning? A. What steps did you follow and why? B. Did you memorize the drug list? C. Who made the biggest mistake? Assacted. D. What was the correct answer to the case? 18. In terms of regulatory compliance, maintaining accurate and secure EDAIC candidate records is essential for A. Meeting accreditation and audit requirements. B. Encouraging informal peer teaching. C. Reducing teaching workload. D. Avoiding simulation exercises. 19. Which communication strategy supports patient safety during multidisciplinary ICU rounds in an EDAIC training program? A. Closed-loop communication. A. Speaking only when prompted. C. Omitting detailed explanations. D. Using abbreviations exclusively. 20. A key advantage of using portfolios for EDAIC candidate evaluation is A. They capture longitudinal evidence of competency development. They replace all other forms of assessment. C. They eliminate the need for reflection. They reduce the need for feedback. 21. In mentoring an EDAIC candidate, scaffolding refers to A. Gradually reducing support as the learner gains competence. B. Providing identical assistance regardless of progress. C. Assigning random tasks without context. Avoiding monitoring a skill acquisition. 22. The most effective way to ensure that EDAIC assessments meet high reliability standards is to A. Use standardized marking rubrics and trained examiners. B. Allow examiners to interpret criteria freely. C. Base grading on candidate popularity. D. Eliminate structured formats. 23. Which principle of adult learning is reinforced by allowing EDAIC candidates to select elective modules based on their interests? A. Self-directed learning. B. Massed practice. C. Extrinsic motivation. D. Knowledge transmission. 24. A comprehensive evaluation strategy for EDAIC preparation should integrate A. Both formative and summative assessments. E. Only summative assessments. C. Only peer evaluation. D. Informal observation without documentation. 25. Which mentoring technique most effectively helps EDAIC candidates transfer theoretical knowledge to clinical settings? A. Guided practice in real cases with reflective discussion. B. Providing theoretical reading lists only. C. Avoiding clinical exposure until after theory is mastered. D. Using random case assignments without feedback. European Diploma in Anesthesiology and Intensive Care, EDAIC. The European Diploma in Anesthesiology and Intensive Care, EDAIC, is an internationally recognized, comprehensive examination designed to assess the knowledge and professional competence of anesthesiologists and intensive care specialists. Administered by the European Society of Anesthesiology and Intensive Care, ESAIC, the EDAIC evaluates candidates through a two-part process: a written multiple-choice component and an oral clinical examination. It covers a broad spectrum of topics including basic sciences, clinical anesthesiology, pain management, intensive care medicine, and perioperative care. The diploma serves as a benchmark of excellence, promoting consistent, high-quality standards in anesthesiology and critical care across Europe and worldwide. Here are the top 5 beneficial uses EDAIC exam. 1. International recognition of competence. Validates an anesthesiologist's and intensivist's expertise to a globally respected European standard, enhancing career mobility. 2. Standardized benchmark for excellence. Ensures practitioners meet a consistent, high-quality level of knowledge and clinical skills, supporting patient safety and effective care delivery. 3. Professional development and continuous learning. Encourages candidates to update and expand their knowledge base in anesthesiology, intensive care, and related fields, fostering lifelong learning. 4. Career advancement opportunities. Strengthens professional credibility, aiding in promotions, academic appointments, and leadership roles in healthcare institutions. 5. Facilitates international collaboration. Promotes shared clinical standards and enhances collaboration among anesthesiologists across countries, supporting research and educational exchange.